first thing we do is we obtain a whole blood sample from the patient. It's brought to our in-house lab, which is a sterile environment where we process all of our samples. Once we receive the whole blood, it's put into our bedside centrifuge and spun at a specific rate. It depends on the sample and the product that we're looking for. 10 minutes for certain samples, other times we spin it at a higher rate, but for a less amount of time for more delicate samples. Once the spinning is complete, we're left with a sample that has separated the platelets from the red blood cells. So we're looking for the platelets here. That's what contains all of our growth factors. The red blood cells here kind of counteract what we're trying to do with the platelets. So the goal here in the lab is to separate the platelets without getting any contamination from our red blood cells. So once that spinning is complete, we move the sample over to our sterile hood for processing by hand. And maintaining sterile procedures, we proceed with processing the sample and getting it ready to give to the physicians to re-inject. And she's just putting on sterile sleeves to, again, maintain the sterility of the sample and make sure that there's no cross-contamination. So the next step is to manually isolate the platelets from the red blood cells. So the result is a sample of platelets or growth factors that is free of any red blood cells, free of any white blood cells, and then that sample is further processed to give us a higher concentration based on the patient's condition and based on the physician's orders.